Welcome to Your Future Starts Now, the go-to podcast for extraordinary women who are ready to step into their next chapter with authentic confidence. I'm your host, Gia Lacqua, empowerment coach, motivational speaker, children's book author, and girl mom. Whether you're a corporate powerhouse or an entrepreneur, this show is designed for you. Your Future Starts Now is more than just a podcast. It's a movement towards rewriting the rules of success for high-achieving women. Are you ready to get unstuck and step into your next chapter? If so, you're exactly where you need to be. Your future starts now. Welcome to Your Future Starts Now. I'm your host, Gia Lacqua. Thanks for tuning in. Today, I am so excited to introduce you to Dr. Kahn. Gilly is a licensed clinical psychologist working in a private group practice in the Atlanta area. She specializes in individual and group therapy, focusing on neurodiversity, anxiety, and depression in youth. Over the years, Gilly developed a niche in the treatment of children and teens with ADHD and ASD, because in her opinion, there's no better or wiser company, as Gilly also has ADHD. Gilly, welcome to the show. So happy to have you with us today.
Thank you so much for having me here. I'm excited to get started and to launch this amazing podcast.
Thank you. We hear a lot about neurodivergence these days, and I know that's a big focus area for you. So, today we're going to talk a little bit about mental health in general, for women, for children. But let's just start with neurodivergence. Start with the basics. Can you tell us a little bit more about what is it? What qualifies as neurodiverse?
Okay, so when you hear someone referring to neurodivergence, basically they're referring to a category in the Diagnostic and Statistical Manual, and the category is called neurodevelopmental disorders. And basically, the idea behind that category is that the conditions in there are heritable and they're brain-based, which is different than, for example, post-traumatic stress disorder, which does have a brain-based component, but also an external trigger. And so for neurodevelopmental disorders, there are environmental factors that contribute to them, but they're mostly biological. And some examples include ADHD, autism, dyslexia. And so the neurodiversity movement is not, so if you're neurodivergent, this isn't like classification or something that's in the DSM, the Diagnostic and Statistical Manual, which is the diagnostic classification system that psychologists use in the US. But this is more of like a pop culture term, basically normalizing people who fall under that umbrella. So instead of considering it a disorder, they're considering it more a condition where people who are neurodivergent just have different ways of thinking and processing information. And they're mostly struggling because we live in a society where things are designed a certain way, especially the education system, and we don't necessarily fit that mold.
It's evolved, over time, it sounds like, from being more of a disorder to, it's just a different way. People think differently, right? And recognizing that it's a spectrum.
Exactly.
You talk a little bit about the educational system specifically. Can you elaborate on that a bit?
Yeah. So the way that schools work, I guess, at least in the US, there's this very structured system. And right now there's even more emphasis on, having to sit still at a desk, or, having to pay attention for very long periods of time. There isn't a whole lot of movement involved. Mm-hmm. And the way that reading is taught is not necessarily the way that a lot of children will understand it. And math too, by the way. I mean, I see kids in my practice where they will describe their homework assignments to me, and I'm just like, what? But then they're told they have to learn it this way.
Yeah.
And that's very frustrating because, there are other ways to do the math and arrive at the same answer. but then to get the points on the exam, they have to do it this way, the specific way that they're taught. And so, yeah, I mean, I constantly see working with youth who are neurodivergent, that they hate school, because they also don't really understand. They say, I don't understand why I have to learn this information if I'm not going to be doing this in the future. Or if, I'm so good at this thing, but like this other stuff is so hard for me. I just can't get it. And so, and I guess they're tired of hearing too lectures about why school is so important and how, it's providing the basics or the, what did they say? Like the foundation, right? The foundation for the stuff we'll need to do in the future. But the truth is, and I'm speaking as someone with ADHD, it's really hard, to focus on something that's just not interesting to you or that's just really hard to do. And it's true, you don't necessarily have to use it in the future or in that particular way that it's taught to you, and you can still be very successful. So yeah, but it would be a large undertaking to change, the school system because everyone has such different needs. It's a complicated issue.
Yeah, it is a very complicated issue, but I appreciate you pointing it out because I think a lot of people struggle with it. I think even neurotypical children, right, struggle with the traditional educational system in the US.
Yeah.
And then you add the neurodivergence on top of that. And certainly I could see how that could complicate things significantly so, because every child learns differently. And so it is a really complex but important topic. And I can't help but wonder, think about ways that we can help to evolve and shift the educational and the learning system. And like you said, it's not going to be an overnight change, but maybe gradually over time.
Right. Yeah. I think people also need to be a little bit more flexible. And we have such an emphasis on school in our culture. And this really goes in hand in, I think, like in line with what your podcast is all about, high achieving women, and and it doesn't define you. And I think that parents and kids often lose sight of that, that life is not school or, which college you got into. And kids feel a lot of pressure, especially neurodivergent kids, because they're comparing themselves to other kids who can process information more quickly or who are able to do things in the way that the mainstream school system has things set out to be. So yeah, the challenge.
Yeah, for sure. And you are very open about your diagnosis. I'm wondering if you could share a little bit about your journey to diagnosis. And, it was recently, right? As an adult, you were diagnosed with ADHD?
Yeah. So I was diagnosed when I was 33, but for 2 days I've been 34, unfortunately. I guess that's how life works.
Happy birthday.
Right. Thank you. But yeah, so it was a few months ago. I don't know, maybe it was a year ago. I'm time blind, kind of. Yeah. So basically, for many years, I wondered whether I had ADHD. The problem is the way that ADHD is understood. Even now, a lot of practitioners are not really up to date on the science and the updates that are kind of occurring in the ADHD community. And so they still kind of have an old way of thinking about ADHD. And the criteria for ADHD were developed mostly for boys. So when they were doing research and using that research for the diagnostic criteria, the samples basically just consisted of boys. When I say boys, I don't mean men, I mean like child boys. And so that's a problem for adults in general, but also girls. So I remember in graduate school learning that girls are more likely to present with a predominantly inattentive presentation. So there are 3 different presentations to ADHD. There's the predominantly hyperactive, predominantly inattentive, and combined presentations. And predominantly hyperactive is basically what it sounds like. It's like when hyperactivity is kind of the main issue, hyperactivity, impulsivity. Inattentive is more like the daydreamer, space cadet, like slow processing. And then combined is both. And typically you don't really see a lot of predominantly hyperactive unless it's a really little kid.
Mm-hmm.
So you typically only see like combined or inattentive. And we were taught, and this is what a lot of the research shows, that girls are more likely to present with a predominantly inattentive presentation. So girls are more like the space cadets or the daydreamers. But then it's hard to, I think, draw that conclusion when the criteria were developed for boys. So we're really limiting the scope of what's being understood for girls and women and the way that ADHD presents. Because, you know, you could be spacing out, but also, and I was having this conversation with a client actually not too long ago, it's like when I sit still, I feel like there are bugs crawling under my skin. Like
Mm-hmm.
I can do it, but I'm dying inside.
Mm-hmm.
And that's not visible. And so girls are really complicated. And so that's why, you know, there really needs to be more work in this area.
So interesting. And then I think also adding to that or contributing to that, and I know you talk about this as well, is the fact that girls are really good at masking, right? They're good at being compliant in school and doing things that they're supposed to do and falling in line, to your point, even when it's super uncomfortable on the inside. And I know that that also has led to girls being underdiagnosed, right?
Yeah. Actually, like, so the research shows that both girls and women have better social skills than boys and men, and that makes sense. I used to study peer relationships, friendships, a few years ago, and so one of kind of the most well-known things about girls' friendships versus boys' friendships is that girls tend to have like more intimate, dyadic, like one-on-one relationships, whereas boys tend to hang out more like in groups. And their friendships are more about just kind of like play, like spending time
Mm-hmm.
together, hanging out. It's considered like, you know, like less like intimate, but that doesn't mean they don't have close friendships. It's just
Sure,
that it manifests in a different way.
sure.
But because, you know, girls are, you know, just physiologically, and also raised, you know, socially,
Yep.
environmentally different than boys, the girls' friendships are way more complicated. So girls tend to be sneakier, and you know, when you're thinking about like bullying, for instance, girls' victimization includes more than just physical.
Mhm.
So girls typically don't get physical. I mean, they can, but it's mostly like relational. Like they'll gossip about each other, spread
Yeah.
rumors, exclude each other. And all of that takes social skills. Like you have to have a really good ability to have, you know, perspective taking and how to socially manipulate things in your environment. And so lately there's been a lot of work on masking for girls with ASD. And I think that ADHD falls under the same category with autism spectrum disorder,
Mhm.
and they're so highly comorbid, or they happen, you know, at the same time for a lot of people. And we're behind on understanding the same thing for girls and women.
Mhm. Yeah, I think that's important to recognize. And in addition to the ADHD, ASD, you know, I also want to talk a little bit about, because our listeners are high achieving women who are, you know, doing it all. And many, like myself, have gone through situations where we're encountering burnout and experiencing physical manifestations of stress because we are not taking care of ourselves, right? We're not doing the things that we need to do because we're so focused on everyone else. And it's just so common. You know, and obviously we recognize that something's got to change, something's got to give. And certainly that's also another complicated issue that's multifaceted. But anxiety is one that keeps coming up. And it's one that I have struggled with, one that I hear a lot of clients and other women deal with, and especially post COVID, right? I think we still have a lot of work to do. I think there's less stigma around mental health in general. I think more people are open about getting support. And I think we're seeing, especially since COVID, I think an increase in anxiety and other mental health disorders. But I'm curious, from your perspective in your practice, what do you see as current trends or challenges in mental health, specifically with women and then also children these days?
Yeah. So I think, on other aspects of ADHD that are very interesting for women, are a lot of the things that you're describing. So I am a high achieving woman. I mean,
Mm,
I'm 34 and I have two kids. My oldest is 6. And I have a PhD in clinical psychology. I also have a separate master's degree in experimental psychology. I'm writing a book. I'm going to start blogging for a magazine. I'm doing this. It's like we're constantly like juggling all of these
yes,
balls.
yes.
And it's like this need to fill a void. But then once you accomplish one goal, you're like ready to move on to the next one. And I see it as like dopamine searching, basically.
Hmm.
So a lot of women with ADHD who have low levels of dopamine in their brain. So dopamine is the neurotransmitter, which is like a chemical in your brain that makes you feel good, motivated, fulfilled, just happy. And it's associated with a lot of stuff like depression, ADHD symptoms, migraines, even a lot. But basically, when you get a dopamine kick, it's like you feel really good in the moment. So when you achieve something, then, there's a lot of dopamine that's being released in your
Yep.
brain. And people with ADHD have naturally lower levels of that. So they're trying to compensate and they're filling their plates. Like I'll talk to, especially moms now because women, our generation, like they are getting diagnosed very late with ADHD
Yeah.
because there was so little knowledge of it and also because of the stigma, and there still is stigma surrounding it.
Sure.
But for example, like they'll say like, oh, but I'm doing all these things and I'm so successful, but are you happy?
Hmm.
And then why are you doing all of these things? Just because you're doing a lot doesn't mean you don't have ADHD. You could be intelligent and have ADHD too. And you're really just kind of seeking out things to do to compensate for the low stimulation that you have on the inside.
So fascinating. And I think you just perfectly described so many high achieving women, especially the working moms. And as you know, you're doing it all, right? You're school, education, work,
Right.
writing a book, right? Raising kids and doing it all very successfully. And I think that also is a stereotype, right? That people with ADHD or other mental health disorders are
They
not
can't. Yeah.
successful. Yeah, they can't function, right? And we know that that's just not true. And I love
Yeah.
what you said about like, why are you doing all these things? In the work that I do in my keynotes, I talk about this concept of the arrival fallacy, right? We're chasing the next goal. And
Hmm.
once we get there, once we climb that peak, we don't just stop and say relish in our accomplishments and our achievements and really celebrate what we did and take a step back. No, we haven't taken a moment to celebrate because we're already on to the next goal. We're already on to the next thing,
Exactly. Yep.
right? And so yeah, so I think that's such an important point. And then taking a step back to question like why? What is that drive? Is it truly internal and heart centered? Is it the chemicals in our brain, right? What is it that's really driving that desire to achieve and accomplish?
Yeah. I think for me, just learning more about the chemicals in our brain, it just normalized it for me
Yeah.
and it took the pressure off. It was just like, listen, there's a biological reason for what I'm
Mhm.
experiencing right now. I can explain it. And then it's not about me failing, it's about just the way I function and just, I think education is power, like knowing, why your body is doing what it's doing. And that's why I actually spend a lot of time in the beginning, providing psychoeducation to my patients. And the other thing I do is, like if my patients come in and they're like, hey, I'm taking this medication. I'm just like, do you know why you're taking that medication? No. So I'm like, let me
Mm-hmm.
educate you. I mean, I'm not a
Mm-hmm.
psychiatrist, and I say, talk to your psychiatrist about this too.
Sure.
But I think it's important to know why you're prescribed what you're prescribed, and, to understand what it's doing, like when you're taking it.
Yeah.
So, yeah.
You also talked about fulfillment, which I think is another important point to this is, when we accomplish something, are we truly achieving that inner sense of accomplishment, and fulfillment? Or are we doing it for some external reason, to
Mhm.
get the validation, the reward, the accolades? And I think also pausing to recognize, like, what does this mean to me can also be really powerful, as opposed to just keep going in that cycle. It's like the hamster wheel. So
Mhm.
getting off the wheel and stopping and pausing and really taking, time to reflect and be introspective when it comes to what are we accomplishing and why are we doing it, I think can be really important. You talked about women struggling with ADHD and, anxiety. I'm curious, what would you say? I mean, obviously, other than a clinical diagnosis, right? What are some signs or things that women should look out for, or sort of be more sensitive to or in tune to, if they suspect ADHD?
So I think in this day and age, like in this generation, it's probably going to start with you taking your daughter to a psychologist, because that's what I see just with a lot of patients. There's no mental health history. And then they bring their kids in and they're like, here, fix my child.
Mm,
Um, but I would say, whatever feedback you're getting about your kid, like turn that around and think about yourself too, because the apple doesn't fall far from the tree. And it's not a bad thing, like we need to get rid of this preconception of like, if you have a mental health diagnosis, it's a bad thing, or you're, messed up in some way. Like it's just like, understanding that you have low iron levels. Are you
mhm.
just gonna stay in the dark, or, are you gonna go treat it? So, if you take your kid in for therapy and the therapist says, well, I think your child is struggling with ADHD or OCD or autism,
Mhm.
and then you take them in for testing and it's like confirmed, then you should probably go ask your primary care physician, like consult with another professional and really think about um, your past, so you could start addressing your challenges. Yeah,
Wow. Yeah, it's almost like a mirror, and I've noticed that in so many facets of parenthood and becoming a mother, right? And just doing that self-reflection. So, such a great point, right? And when you're learning more about your child, it's also an opportunity for you to learn more about you,
yourself. Yeah.
yourself, right? And because I think also when we were growing up, things were very different, times were very different. Mental health isn't what it is today. And so take that as an opportunity. Can you talk a little bit about some of the benefits, right, of being neurodivergent and not being neurotypical?
Yeah. So there were a couple things that I thought of when you were talking about, kind of checking the boxes and accomplishing goals, but then
Mhm.
still feeling empty and wanting
Yeah.
to move on to the next thing and working toward getting praise or recognition for what
Yeah.
you do. And so this is an under-recognized piece of ADHD, especially for women. It's the emotion dysregulation part of it.
Yeah.
So emotions are not even part of the criteria. And if you think about it, it makes sense. If the criteria were developed for little boys, like if you're observing boys, then they might be rowdy, but you can't really tell. And even with girls, like you can't look at them and be like, ah, this girl's depressed. I mean, maybe you can, but it's much more complicated than that.
Yeah.
And the same brain areas involved in impulsivity and inattention and, the ADHD diagnoses are the ones involved in emotion regulation as well. And so there's a neurobiological component to it as well. And so the emotional piece is very important. And there's this term that was popularized by William Dodson, who's a psychiatrist. It's rejection sensitive dysphoria. And there's very little research on it. But basically a lot of people, since it became like very popular, a lot of people with ADHD have sort of come out and said like, oh yeah, I struggle with that. And there needs to be more research in that area. But rejection sensitive dysphoria is basically this heightened sensitivity to perceived criticism. But it also goes the other way. It's also heightened sensitivity to praise. So if you feel like you failed at something, then it like is so painful that people who have this, they report feeling this like intense pain in their chest. And I do. I am all on board with looking at this more, because even if it's the stupidest thing, I can get so upset about it and it physically hurts. But on the flip side, if I succeed at something, it's like manic. You're like on cloud nine.
Yes.
And there's a chance that people with ADHD experience this more, like more intensely than people who are neurotypical. And so it's likely that people with ADHD just feel very deeply, they're just very empathetic. I know I've seen a lot of teens who are autistic, and they are very sensitive to emotional content.
Yeah.
Because they feel the emotion so intensely.
Yes.
And that's what makes it hard to process. So, we feel very deeply. The other pro is hyperfocus, and all of these are not included in the criteria. So hyperfocus is basically when you're so interested in something. Like for me, it's psychology. I mean, it almost seems like I'm obsessed, like my husband will walk into the kitchen. It's like my day off, and I'm listening to Russell Barkley on YouTube. Like, this is fun for me, and he doesn't get it. Like, sometimes he doesn't get it. Like, he'll be like, like, it's all you can talk about. And I'm just like, because I love it.
Yeah.
And, and I think that's a benefit, because you can really become an expert in your field.
Yeah.
And because you're so passionate about what you do, and that's where the fulfillment comes in with work. Like, I just love being a psychologist. So it's about finding your thing. But then, the con of that is I'm Dr. Kahn. So the con of that is that, when you have to do something you're not interested in, honestly, it's like I black out. Like, my husband talks to me about history, and he looks at me and he's just like, you didn't hear anything I just said. Like, you just can't process the information. But when you're interested in something, you're like all in.
Yes. So interesting. And thank you for sharing that. I think the hyper focus and recognizing the deeply feeling aspects, I think, is important for people to recognize, and that there are terms and there is research, right, that supports, and evidence that supports this, because I think sometimes we feel so alone. We feel like we're the only person going through something, or we feel like we're the only person experiencing something. And the reality is we're not. The reality is that there's a lot of people going through the same things, having the same experiences and feelings. And sometimes just hearing that can normalize it for people, and recognizing it and being able to be vocal about it, and getting the support that, they need. So thank you for sharing that. I think those are really great things to be aware of. Tell us about, I know you said you're working on a book. I would love to know, do you want to share a little bit more with our listeners about your book and when we'll be able to get our hands on it?
Okay. It's going to be a while because I'm going the traditional publishing route, and that's a slow move. But at the same time, I'm a debut author, and so this is what I'm just choosing to do in the beginning. So I'm working with a literary agent with the Weiss Agency, and we are together going to propose. I don't know, it might be out, I guess, for submission by the time this is coming out.
Mhm.
But we're working on proposing a book on the role of rejection sensitive dysphoria and emotion dysregulation in ADHD for women.
Awesome. That sounds so exciting. And I can tell you're so passionate and lit up about the work that you do, and I can't wait to read it. Dr. Gilly, what message or call to action do you have for our audience? Any other tips or tools that you would like to share?
Yeah, so I thought, the other thing I think that's really important to, I guess, to send as like a take home is just involves anxiety. Because I'm sure that a lot of the listeners are probably overwhelmed, and they're high achieving. I mean, they have a lot on their plates. And a lot of times that can manifest as physical discomfort.
Yep.
And a lot of people don't know that too, that
Yep.
anxiety can appear physically. But a lot of times, people will come into therapy, and I work at Anxiety Specialists of Atlanta. So we're anxiety specialists. So when they come into therapy, they'll basically say, like, I would like a coping toolkit, or coping tools to get rid of or reduce my anxiety. But our brain is kind of messed up in its own way, because the more we try to control or get rid of something that happens naturally, the more it backfires.
Mm.
So if, let's say, like, we're having a panic attack and we're just like, okay, deep breathing, progressive muscle relaxation, like, let me relax my muscles. What can I do to get rid of this feeling? It can only amplify, because the goal is to get rid of the anxiety. And so that's why I spend a lot of time in the beginning of therapy educating clients about how anxiety is actually helpful. So, it's kind of like how we said before, like conceptualizing things as less of a disorder and more
Yeah.
a condition.
Sure.
Your body does things because we are designed in a way that helps us survive.
Mhm.
And so anxiety exists for a good reason. It's really to protect us. But sometimes our brain can get confused and make us think that a situation is like dangerous or threatening when it's actually safe. And so a lot of my work with clients has to do with very similar to what I think you talk about in your book. So a lot of it is acceptance and commitment therapy. And it's about just kind of, accepting whatever feeling you're having.
Sure.
It includes a lot of mindfulness, goal setting, and focusing on what matters to you. But the flip side of that, and people think it's like crazy that we do this, but is exposure therapy or exposure response prevention.
Yeah.
Because if you're not, just accepting or kind of going with the flow, then the other side of it, and I'll usually start with ACT, and then if that doesn't help, then I start moving into exposure therapy, because that's more of like a bring it on attitude.
Mhm.
Like, oof, anxiety is chasing me around, it's hunting me down. You know what? I'm going to be the hunter now. So bring on the anxiety.
Mm.
So it's really flipping things on its head, and it's seeking out anxiety as opposed to having it control you. So I guess, like, my message is be the hunter, not the huntee.
I love it, and get curious with it, right? It's such valuable insights. So the same is true about, traumas from our past or, negative experiences that we haven't processed. And a lot of times we suppress them because we've learned to suppress uncomfortable emotions. And what happens? It just continues to grow. It
Exactly.
continues to get worse. And so until you're able to sit with the discomfort and process the uncomfortable feelings, it is just going to continue to fester. And so such great advice. I love it. And I think it's so powerful for people to recognize, we actually have power, more power than we believe, and we can take action to help ourselves. And also, of course, seek external support, which is so important. Dr.
Exactly.
Gilly, thanks so much for being here and sharing your insights and expertise. Where can our listeners find more about you and the work that you do?
So you can find me on Instagram at Dr. Gilly Kahn. I'm also on TikTok. And then I will be posting stuff on there with more podcast episodes and blogs and things to come, because I have a bunch of stuff that's in the works.
Awesome. I love your content. So keep it coming. And of course, you can visit my website at gialacqua.com. Reach out to me on Instagram at gialacqua with thoughts, feedback, comments, and questions on this topic and what you'd like to hear about on future episodes. This is Gia signing off with gratitude for your time and energy. Our mic drops, but the movement continues. Until next time, your next chapter is waiting.
That concludes another empowering episode of Your Future Starts Now. Before we wrap up, I want to thank this incredible community of high-achieving women. Your energy, resilience, and commitment to growth are the driving force behind what we do. If you enjoyed today's episode, please rate it, leave a review, and don't forget to subscribe so you never miss an episode. Your feedback fuels our mission to empower high-achieving women just like you. And of course, share Your Future Starts Now with the extraordinary women in your life who are also on a journey of healing and empowerment. Connect with us on social media, share your thoughts, let us know what topics you'd like to explore in future episodes. Stay connected on Instagram at gialacqua. I encourage you to carry the energy of this conversation into your day and keep on supporting the incredible women around you. Until next time, remember, your next chapter is waiting.